Okay, Natalia, I'm so happy you're on the Mind Your Hormones podcast today. I know you have been a listener for a while. Such a full circle moment for both of us getting to sit down and chat together. And I'm really excited for this conversation. I know we're just going to go in so many different directions. And whether someone listening is a mom, they're a mom to be, they're trying to conceive, like it's going to really support them in so many different ways. You're a holistic psychologist who you support, motherhood, you talk about trauma, and it's just going to be such a good conversation. I cannot wait to get into everything that I have down for us to talk about. But before we get into everything, I would love for you to just introduce yourself and explain like what a holistic psychologist actually is for people who might not even understand that terminology.
Yeah, thank you so much for having me on. And yeah, it is full circle for me to just listen to it and use your method and have it just be like we already know each other. That's how I feel. So yeah, so
And
I
you're also a
am
mom. She's
and a
also a
mom.
mother.
Yes.
Yes.
So yes, I am Dr. Natalia Rappa. I'm a holistic psychologist and a new mom. My son is 13 months old. And yeah, I with holistic psychologist, as far as what that means, right?
Mm-hmm.
I think that's where a lot of our stuff aligns in that idea that a lot of my focus has become about identifying and really working with like the root cause of people's symptoms around anxiety, around depression. Because in my early work, getting to where I am, I initially studied clinical psychology. I worked in a school similar to you. And then
Mm-hmm.
I decided like I really wanted to focus on clinical work. I really wanted to just hone in on my passion around working with people individually. So I left the school setting, which was tricky, but so worth it. And
Same.
ultimately, yeah, and you were a big inspiration and all that. So,
Oh, that's so
it was
cool.
just like, yeah, it just made sense. I always had that calling to do the clinical work. And then as
Yeah.
I got into it, I just started noticing that people just were only getting so far with like CBT, which is a lot of my background and schooling
Cognitive
around
behavioral
cognitive behavioral
therapy.
therapy,
Yeah.
as well as mindfulness and like integrating those. So I was doing that a lot, but still noticing that there were people that would just get stuck. Like they would get to a certain point and they would just, be like, I know what I'm supposed to do. I know the things, I know the tools, and it's not transferring over
Mm.
to how I feel and to like how I show up. And so I think through my own just like research and reflection and just recognizing this and saying, I feel like I need to get trained in something else.
Mm.
And EMDR popped up for me.
Mm.
And it actually, so EMDR, I don't know if you're familiar with it, but
Yes,
it's,
I'm actually
yeah.
my personal therapist who I go to. She does EMDR, and I'm like possibly going to do it. Haven't done it yet, but I'm very interested in it.
Yeah. So it's like a reason why we're talking. Yeah.
Yeah, I
So
know. I'm like you're
ultimately,
about to convince me to go do it.
yeah. So I decided to get trained in that. It was really just like a call. It was like, I
But
think
for
I should
people
do
who
this.
don't know what it is,
Yeah.
you
So
could tell
it's
them.
IEMDR. So it's eye movement, desensitization, and reprocessing. It's a very long name for
Yeah.
basically what we'll talk about. I can explain it more. But yeah, I got
Mhm.
trained in that as an idea of really like, okay, this is going to help me to really focus on the root cause and address it. And
Which is like trauma. It helps bring up and
yeah, so
heal
it is an
trauma.
evidence based treatment for trauma. It was
Mhm.
initially created for post traumatic stress disorder, but now it's being utilized in a more broad sense for anxiety and depression because it's my belief, and there's a lot of evidence out there that ultimately those are just other symptoms of trauma, right?
Correct. Yes.
So that is where it started from, and it actually also started or was created, which I know that you'll love this, from the founder who, when she started, I guess, her work, she noticed in her own life that when she would walk, she would just like process information better and have better problem
100%.
solving and just
Mhm.
like come to more adaptive resolutions of things
Totally.
naturally,
I
right?
mean, that's so true. I mean, I feel like everybody could agree with that.
Yeah.
I like built
I
my
mean,
business on walks, like
we're all
literally.
walking, right? There's like a reason
Yeah.
why we're all walking.
Yeah.
Yeah. So when you walk, your eyes move in a particular way without you knowing that it happens. Your eyes
Wow.
move back and forth. And that
Mm.
she noticed that, right? And then started to implement that with veterans and using that to
Wow.
ultimately help them to resolve these traumatic events.
Mm.
Um,
Now, I
mhm,
just
go
want
ahead.
to pause on that for a second because people
Yeah.
might be listening to this and be like, oh, like I don't have any trauma. So,
Oh, yeah.
can you talk about like the ranges of what trauma can be? Even like childbirth can be trauma, even if it's a beautiful experience. Like I had an amazing birth, but
Hmm.
I still think it's a trauma to the body. You know what I mean? So anyway, but there's like so many different little
Yeah.
things that could be trauma. So can you just like touch on that for someone listening who might be like, oh, I don't think I have any trauma, but they might be experiencing anxiety, depression, whether that is before they're trying to conceive, whether it is in postpartum, whatever
Mhm.
stage of life.
Yeah. 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 I mean, I think the first thing is to say trauma is subjective.
Mm,
Trauma is not about what happened, it's about the way it was processed, right? And your
mm,
experience of it.
so
And
good.
so, birth, it's not about what happened, right? It's about the narrative that sticks with you, the story that sticks with you afterwards
Wow, that's so
that
good.
ultimately becomes the trauma, right? So
Hmm.
it's not about like blaming you that like it's your, story.
Yeah.
It's just that the way that it gets processed and metabolized, right?
Mm,
In that way, it can get kind of stuck in this place of this emotional state. So,
mhm.
a way for you to kind of have a sense of maybe whether or not it's trauma related, like if there's things that you're experiencing now around anxiety, depression, a big thing is looking at your responses, right? If you are having like these emotional responses, right? And having a sense of like, does this match, right, the
Mm,
actual stressor that's occurring in the moment,
so good. So
right?
meaning like if there's something quote unquote small happening and your reaction is bigger.
Yes, yeah.
Right.
So
Even if
basically,
it's not small, like it's the ratio to what the actual event is and your reaction to it.
yeah, like, and not in like a necessarily judgmental way, but like, okay,
Right.
there's this thing that's occurring, but my response doesn't match up to that. And that
Correct.
comes from that idea too, which you may have heard of, but just that sense that if it's hysterical, it's
Hmm.
historical. If it feels like it's really extreme or hysterical, right, or like more than what the current stressor is presenting to you, it's very likely that there's history attached to that emotion that's
Ooh,
coming up.
love that.
So you're not just feeling what's happening in the moment, you're feeling all of the memory that lives in your body, right,
That was
that's
never
connected to that
processed.
emotion that is being brought up.
Oh, I love that. Okay, so let's just stick with that for a second since we're here.
Yes,
So I love how you said like the trauma is
subjective.
not what actually happened, it's how you process the event. So I
Yeah.
feel like a lot of us, probably most everybody, in childhood, like even if it wasn't a huge, big traumatic event like, sexual abuse or, anything like that, which of course some
Hmm.
people listening could have had that
Yeah.
experience. But when things happen to you as a child, if you don't have the tools to process things, whether it was a divorce, whether it was a death in the family, whether it was bullying, like could be literally anything,
Hmm.
if you didn't fully process it, that could be something that's stuck with you now as form of trauma, right? Is that correct?
Hmm. Yeah, yeah, and it's not that you didn't necessarily fully process it, you just processed it in a state that then it got stuck in the emotional state of it,
Hmm.
right? And in that way, you took something from it as, let's say, you were bullied, right? And then you got that sense of, okay, this means that I've taken from that this means that I'm unlovable, right?
Mm.
Then that becomes, right, the way that you processed it, right, is like, okay, that's what I got from that, that's how I digested it, right? But now going back, right, so then every time maybe you feel rejected or something occurs where someone makes a comment, right, or is judgmental in some way or the other, it's like, okay, there's more evidence that I am unlovable, right?
Mm.
It becomes like the lens or the glasses that you wear to see the world, to see every other experience that you go
Wow.
through.
That's so good. And
So
it's
that,
even like, even if that person's is intent isn't to make you feel that, because no one can make you
Right.
feel that way. You know what I mean? It's like, that's just
Yeah.
what you're perceiving is going on
Yeah.
because of your history. Okay. I love that.
Yeah.
Um, okay. So we could go so many different directions with this. So
Yeah.
while we're on this topic, so for someone, if they're listening, they're like, okay, I definitely know that I have, maybe reactions that don't match what the actual situation is, whether that is in motherhood, right? Or it could even not be motherhood, doesn't matter. Um,
Hmm.
what are some things that like you would recommend either like immediately doing, or what they could like kind of talk themselves through like in that moment, if they
Hmm.
are realizing like, oh, okay, now that I know that this is something I do, when it comes up again, like what can I start to do to help heal this? And obviously there's like so much deeper work that needs to go on with this, but just
Yeah.
like in the moment things that we could
Yeah.
maybe help prioritize and help regulate ourselves, especially if you are a mom and maybe you're a mom to toddlers and now they're having a lot bigger emotions and like all of that.
Hmm. Oh yeah. Yeah. I mean, motherhood is like a
Yeah, we're gonna do a whole thing on
sea of
that.
things that
So,
can bring up like all of those
oh yeah, we'll get to
emotions.
that.
Yeah. But yeah, so no, I think it's really that sense of a good question to ask yourself is, how old is this?
Mm,
Right. So when you feel something intense, right, and you can, with compassion, not with judgment, but with an awareness of like, okay, this feels big. Like there's this scenario that's happening, but this feels bigger than that.
mm.
Right. That sense of like, how old is this?
I
Right.
love that.
How often have I felt like this, in a recognition that, and that can just help to cue for you that like, okay, there's this other piece that's happening, right, that is about almost this feeling that's coming on my body, is because it feels as if I am reliving whatever else has occurred, right? So that
Mm-hmm.
idea that, okay, how old is this? All right, this is old, like this is like 6 years old, right? This is like whatever age it is or
Yeah.
time frame it is, to help you to recognize like that awareness of like, okay, I can notice that, I can just not respond from that place. I mean, there's also then the regulation piece of it more physically, that I would say would be more about like grounding exercises for sure.
Mm-hmm.
Like a 5 4 3 2 1 exercise, anything that's going to, I don't know if you know what I'm saying with 5 4 3 2 1,
Yeah,
but
I
using
do,
your
but someone
senses.
listening might not.
Yeah.
So
So
you
like
could
five
explain it.
things you can see, right? 4 things that you could touch, and going through your five senses to just bring you back into the moment. Because what happens when you have that trigger, right, is that your nervous system is getting pulled back into that place where you
Mm-hmm.
were whenever that trauma occurred. And a lot of
Mm.
us, if you have, maybe you don't think you have big trauma, a lot
Mm-hmm.
of it is very small instances
Like a lot of them.
over time that would be more
Yes.
like complex trauma, right? Or
Mm.
a bunch of like little paper cuts that you've had,
Yes.
right?
So
So, yeah.
So to expand on the 5 4 3 2 1 for someone, saying that's a really good tool for people if they don't know it, that, even if they're just experiencing anxiety, they're in the middle of a, situation, whether that's with their partner or with their child or whatever, this is a really good tool you could do like right in the moment. So I'd love for
Yes.
you to, so you said 5 things you could see, 4 things you
Yeah.
could touch.
Yeah, then 3 things you can hear. No, I'm sorry. 3 things, yes, that you can hear. 2 things that you can smell, and then 1 thing that you can taste. So sometimes like
Okay.
the taste thing is like, maybe that's, you can cut that out. You don't
A
have to
sip
do,
of
you don't have to
water.
go through the full thing. Yeah, taste your
Yeah.
water,
Yeah.
right? Smell whatever's in the room or outside of the
Right.
room, right?
Just brings you in the
Touching.
present moment.
Yeah, just really connects your mind and your body, right? Your focus back into like, this is where I am where my body is in this very moment.
Mm-hmm.
Because a lot of trauma is, yeah, about you not feeling connected to the moment, it's so powerful, right? What our mind and our body
Oh,
can do to bring us back into scenarios that we're no longer in, but we're reliving.
yes, I
Yeah.
love the question, like, how old is this? And like, when did this start? And it's so funny because I've done that to myself before, and like, just like random ages will just like pop in my head. I'm like, okay, I'll just like go with it, right? Like, try not to overthink it too if you're
Yeah.
doing this. But it's just so interesting how like you could just like zoop, like go right back to like a specific moment, or you don't even know exactly when, but it's just like, oh, an age, like will just like pop in, and you could just like feel in a different way, which is so crazy. So I want to get into motherhood, but before we do that, while we're still on this topic, so for people who, because obviously there's a connection to from like my lens of everything, like when you have these traumas built up, like they do create blocks obviously in your body that can of course impact your mental health and all of that, but it could impact so many other things in your physical body,
Yeah.
like physical ailments, fertility, like all these things. So someone listening who wants to heal this, you do talk therapy as well as EMDR.
Yeah. In combination, usually. Yeah.
Okay, so in your opinion though, do you feel like EMDR, other type, like that type of healing is what's going to really like get down to the root of it on aside from just talk therapy?
Yeah. Yeah. Yes. I mean, yeah. I definitely I think that there's always the piece of like someone being open to and in a place of like choice to entering into EMDR. So it is, I think a big factor of having you feel a certain level of, stability and safety and moving
Right.
into doing something like EMDR because it is different than talk therapy. It does have you sit with things that you typically avoid. It
I've
does
heard it gets
have
worse
emotions.
before it gets better kind of
Exactly.
thing.
Yeah. So like
Okay.
the emotion can rise up or feel like it's almost strengthening as you're going through it. But you set up a lot of like tools and things before to kind of make sure that you feel really, like you have a good toolkit. So that's
Mhm.
a big part of EMDR too.
And is this a long process, EMDR, usually?
Everyone is different, so
Oh,
it's
okay.
not like an exact timeline. For some people, we can open up something and start working through it, and it could take, they could resolve something in a session.
Oh,
Some
wow.
people could, take a couple of sessions or
Yeah.
longer, or we could start with one thing and then something else could open up within that, right?
Hmm.
So it depends on, everyone, but yes, I would say that for what I've noticed, it's more effective, especially for people who maybe have tried talk therapy before or feel like, you know what, I know these tools and I've learned them and I've tried them and it's just not sticking and it's not changing the way that I feel. Like I know these things, but I don't feel them in a felt sense,
Yeah.
right? That I'd like to.
So two things with that. One, I'd love for you to go through like, okay, like just examples of exactly who could maybe benefit. I feel like everybody could,
Yeah.
but really like who could actually benefit from this so they could like maybe then look into it. And then the second piece of that is like exactly how, yes, it's like rapid eye movement, but what is that actually doing to kick up the emotions? Is it stimulating a different part in our brain? Like how is that actually working? Because I know some people
Mhm.
are like really sciencey and want to like understand why that's
Yeah.
working.
Yeah.
So I'd love to go into those two aspects.
Yeah. Yeah. So the piece as far as initially like an example, like you were saying, right?
Of what it's
Of
for.
I think just let's say someone who has gone through a miscarriage, right?
Mm,
Right. And I mean, that's a very obvious one, but also one that people don't necessarily address, right? Or feel that they have the space to address fully.
totally.
So if someone's gone through a miscarriage, right, then they would, right, be coming in and ultimately, again, it's not about, let's say the miscarriage. It's first really in general, it's the idea of for you, what was the worst part of that experience to you now,
Mm,
right, as you bring that up.
hmm.
And that could be very different for a bunch of different people, right? It could
Right.
be different moments in the process of finding out, going through the miscarriage, or maybe having like a DNC or whatever it is,
Hmm.
right? Or it could be afterwards and how it was sharing it with their family or their people, right? There could be so many aspects of it. Um, so we would be identifying and looking at what is the worst part of it to you and
Love
breaking
that.
down before we even go into the rapid eye movement stuff is breaking down what are the beliefs, the negative beliefs that you have associated with this event, right? And with this image. It's a lot about image and about us creating an image together of that scene. So that it
Mm,
is feels very vivid for you.
yeah.
And then what are the negative beliefs associated with it? What are the beliefs that you'd like to have about yourself associated with it? All of the beliefs are about yourself.
Those are great
Um,
questions for people to ask themselves, even if they don't go through
exactly.
EMDR. Like, so what is, so say those again?
So the first being, what is the negative belief about myself? right, that I associate when I bring up this image of that event.
Love
So
it.
like, and there could be examples of I'm not good enough. I'm
I
unlovable.
did something
I
wrong.
did something wrong. I can't trust other people, right?
Yeah. I'm
Um,
broken.
yeah, I'm defective. I'm broken, right? All these different things. So that negative belief. And then the second one is, okay, as you bring that up, then that image, right, of that worst part of that scenario to you, what would you like to believe about yourself now?
So good. Those two questions are so good. I want everyone to like go back 30 and write those down, because whether you go to therapy or not, like you could ask yourself those questions and even journal on it or whatever, just to like
Yeah.
really help you process and move through that.
Yeah.
So that's such a great example. And obviously it doesn't have to be like a big event like that for someone who could benefit
No,
from this, right? It could just be anyone
no.
who maybe just has anxiety or anything like
Yeah. So
that.
if it's someone that's smaller, like sense of like not smaller, but that they don't feel like there's an identified big event,
Event. Mm-hmm.
but they're experiencing anxiety or depression symptoms, or just feeling stuck like in an area of their life, we can start with just a stressor that's occurring in the moment or recently and do what's called a float back. So we'll start with an event that's whatever, something that occurred recently, an argument that you had with your husband or whatever it is, right? And then bring up, okay, what was the worst part of that to you, right? Break down the image, the beliefs about it, the emotions attached to it, where those emotions are in your body. So we'll connect and identify where the physical sensations of that in your body. And then we'll say, okay, taking all that information, right, of that, those sensations, those beliefs, if you were to bring them in and let yourself float back to an earlier time in your life, maybe when you're a kid or an adolescent, what pops up, right? And it's pretty amazing to see the connection there, because something will likely pop up, right, of an earlier experience. Sometimes it's more recent and it's not from childhood. But a lot of times, the thing that makes our current stressors or events that are traumatic now even more intense is typically because there was some earlier event, right, when we were younger. So we could do that float back piece too. So it doesn't have to be like a big event like a miscarriage.
But I love that, like just asking yourself, whenever you're feeling stress or anxiety of a situation in like your day to day, what if that was the worst part for me? Like, why was, like what feeling came, like those are such good questions for you to ask. Just say like, get aware of like, okay, where is this actually coming from? Like that is so important. Like you're saying, the root cause of it all. I love this. Okay, that's so good. And then just real quick of how the EMDR actually, like what does it do in the brain? And then we'll move on to motherhood stuff.
Yeah. So the eye movement piece, so it doesn't have to be eye movement, first of all. It's just about bilateral stimulation. So it's about the stimulation of both sides of the brain.
Okay.
Right. So what happens when you go through something traumatic, big T, small t, whatever it is, right, is it gets stuck in the side of your brain that is the emotional side of your brain. And what happens is it actually, what?
Is it the left side?
I believe so.
Okay.
That part I always I'm like the side. Yeah. I believe it's the left side. Yeah. But the side of your brain, right, related to emotion, right? And it gets locked there in the sense that it can't access. There's this other part of your brain, right, that is logical, right, that is like, okay, I know what is like rational or not, right? I know that like I didn't cause, right, this to happen, right, this person to pass away or whatever. I know that I didn't do anything wrong, right? And that logical, rational piece. But what happens when you go through something traumatic is it gets kind of digested in a way from that emotional reasoning perspective of like, I am bad, or I'm, guilty, or I'm defective, or I'm whatever. And then it gets locked there and it can't access or communicate with that other part of your brain.
Wow.
So when you open up using the bilateral stimulation, which could be tapping, it could be eye movements, when you start to do that, it allows the communication to open up between those two sides of your brain, and then allows you to really, I mean, a lot of it is so, which I think very much connects to your work too, is just, it's it's naturally what our mind and body want to do. They want to move towards healing. They want, so like you're just allowing the natural process to occur with the extra support and guidance of having a therapist there who's guiding you, who's keeping you on track, or who's noticing when you're getting stuck at a certain point in a memory. And it also just helps you to have that focus of looking at a dot or tapping or whatever you're doing, helps you to create a little bit also of like space from the, you know, intense content and memories and emotions that you are experiencing.
So it's like removing the roadblock so that like this could, you can heal, you can get rid of, because healing it, like you have to get down to the root cause of the problem. Like whether that's the root cause of why you don't have your period, why you're not going to get pregnant, or why you have this chronic anxiety or rage, or like whatever it is, it's like, where is that coming from? And let the body like fully process and heal it, because it's getting locked up. That makes so much sense.
And I feel like for your listeners too, or just people going through it, I think too, there's sometimes that sense of like, you can know all the things, right? But it's like, why is it not working? And I think sometimes just that belief of like, I'm not worthy of, right, like this thing happening, right? And it's like, where does that come from? What's the root cause of me feeling worthy enough to get pregnant, me feeling worthy enough to, you know, have a healthy baby? Like,
totally. And that could go back to childhood, or that can go back to, you know, trying for so many months and miscarriages or whatever it is. Like you said, it could be recent, it could be far away. So wow, that is so good. I love those questions. EMDR, definitely for people to look into that. That's huge. Now let's like move into motherhood stuff specifically, because obviously we're both moms. A lot of people listening to this are on their way to being moms. They're currently moms. They want to be moms in the future. So you have such good content around just like motherhood in general. So there's so many different topics that I do want to go into. One of the first ones is how you talk about like changing your relationship for the need to control things as a mom. Like it's very easy. So, you know, for people listening, if you don't know, I have an 19-month-old now, and Natalia, yours is 13 months. 13 months. Boy, and mine's a girl. So, you know, obviously from like the second the baby is born, everything like shifts and changes. But like that need for control has definitely been something that I didn't realize how much I liked to control things until I had a baby. It kind of like really revealed that part for me more. Just because like you want to keep them safe, like you want to make sure everything is good, you want to make sure you're doing the right thing, like you want to control, like, okay, they're sleeping, I want to make sure they're sleeping so then I could do this. Like there's so many things that you want to control and you just can't. Like you just literally can't. But that need for control, I don't know if it's there for every mother, but I know it's for sure there for me and a lot of my friends who are also moms. But I would love for you to talk about like really shifting this relationship for the need to control, and how, you know, you really just, it's like for me, it's a constant practice of surrender of like, okay, when I put her to sleep, I can't control that she's going to be asleep for this 2-hour nap. She might be up in 20 minutes. There's literally nothing I could do about it. So would love for you to touch on that.
Yeah. I mean, I think there's a bunch of different reasons why it comes up, but I think that a lot of times what happens is there's like a cycle with motherhood of like, okay, I can't control these things, right? So I want to control them, right? So my anxiety, right, increases is like a sense of like it's an unknown, right? And what your anxiety is likely going to tell you to do is to do what's called reassurance seeking, right? Which is to reassure yourself, like, okay, let me check, they're sleeping, right? Or let me like look up one more thing, or like Google one more thing, or like text a friend, or like ruminate about it a little bit more about which bottle I should do, or like whatever the thing is, right? Is like, you know, with food, what food should I give them next? And is this right? How are they going to digest? Whatever, all the things, right? So, but it's when you use the reassurance seeking, it relieves that anxiety temporarily, right? It makes you feel better in the moment, very short term, right? But then in the long term, it's reinforcing the idea that something actually could go terribly wrong if you don't check or double check or look it up.
Like
So
watching her when she was first born, I literally
yeah,
remember just watching her breathe. I was like,
right.
I can't sleep because I can't watch that she's breathing when she sleeps. So like, I need someone to come here, watch her breathing, so I can go to sleep. Like literally,
Yeah.
that's how I felt when she was first born.
Yeah. Yeah. I mean, and I think there's such a natural like piece of like acknowledging as well like the shock of like having a
Oh,
human in you and then all of a
yes,
sudden they are outside of you but you
it's
still
so jarring.
feel so connected to them.
Yes,
So it's like that piece that is natural but is also not anything that I think we've ever experienced until you become a mom and have a
yes,
baby. So you're like what's going on? I was just pregnant.
it
It doesn't like, it just feels so sudden.
It and it does. You don't realize it till it happens. Where like I remember, I think it was like the day we got home from the hospital. I was like sitting on the couch eating, and Madison was in like a little rocker, like swing or whatever, probably like I don't know, 4 or 5 feet from me. And I'm like, she's too far away. I was so anxious. I'm like, I need her next to me. Like I have to have
Mm-hmm.
her next to me. And then like I wore her all the time because I just felt so much better. And there is such a natural thing to that as
Mm-hmm.
well. But anyway, that was like
Yeah.
total
No,
sidebar for
no,
what we're
it's
talking
it's
about.
definitely no, but it's related, I think, as far as just I think because there's that piece of like, oh, what's wrong with me that I feel like this? And I think that that can then block you from like working on it or whatever it is. So I think it also is important to acknowledge like there isn't a lot of space given to processing this huge change.
Oh, that's
Um,
good. There's
and
no
I think
space
it's
given.
no, no. So it's like what? Like,
Let's be
um,
honest.
yeah, there's not.
There's no space given to
So
process it. All of a sudden, it's like, here you go. Your whole life has literally changed in
yeah,
an actual instant.
yeah. Now you are fully responsible for another human being.
Mm-hmm.
And so it's such a shock. So I think
It
it's
really
like
is.
first acknowledging that and then also knowing that, okay, I can kind of like take the power back a little bit by starting to notice that anxiety and notice that desire to the urge to seek that reassurance in the moment and
Mm-hmm.
just that ability to pause, right? To stop and just allow that anxiety to kind of pass through to start to
Yes.
get that evidence that like look, nothing happened, right? Like because we then start to tell ourselves that we're actually doing something to control by checking, by doing
Yes.
something, and we're not.
Staring at the monitor.
So
I'm like,
yeah,
just to say like okay she's not moving like she's sleeping she's good because now it's like I just want to check that she's like obviously always making sure she's breathing but I mean like
yeah,
before I go to sleep I'm like let me check the monitor like okay she's good she's still she's not moving like she should be good to sleep for a while now like
yeah.
it's that's so true it's a reassurance of like
Mm-hmm.
okay like this is in my control this is good like it's
Yes.
for me like for personal example for people to like be able to like relate to this it's like I definitely feel like I've had like a low level of anxiety since she's born and it's not constant but like it'll just pop up here and there more of just like anxiety just from random things that will just like
Mm-hmm.
happen related to her a lot of times it'll happen in the morning and at night and that's why I'm bringing this up related to sleeping because I'm pretty sure every mother can relate to this of like it's like I don't want to say post-traumatic stress but like almost after like your baby is up multiple times in the middle of the night at night when you're going to sleep you're almost like fuck like I don't know what's about to happen in the middle of
Yeah.
the night I don't know if I'm gonna get 3 straight hours I don't know if I'm gonna get 30 minutes and wake up like it's like oh my like we don't know what's about to go down like when we're about to go to sleep we
Yeah.
don't know what's about to happen
Yeah.
so that like anxiety will start coming up it's definitely better now that she's sleeping a little bit better even though the last like 2 nights she was up for 2 hours in the middle of the night but anyway um it comes up
Mm-hmm.
at night and in the morning because now I'm starting to wake up before she wakes up but I'm up and I'm like she could either be up in 5 minutes or she could be
Mm-hmm.
up in 2 hours
Mm-hmm.
and I'm like I feel it on my chest tightening I'm like shit I'm anxious because not only do I want to be able to like wash my face like do a couple meditate do a couple things for myself but
Yeah.
also I'm like I don't want her to have to like wait for me and there I don't let her cry it out but like I'll have her play or whatever and sometimes
Yeah.
she'll just like get anxious I'm like I want to be able to like be fully present and ready when she wakes up to play and like do all the things so it's like the anxiety times for me mainly come up around the morning and nighttime which I'm sure
Mm-hmm.
so many mothers can relate to
Mm-hmm.
um so I would love for you to talk about any ways that we can support ourselves with those anxieties attached, whether it is attached to sleep, whether it's maybe for a mother who works outside the home, dropping your child off somewhere. It's a
Mhm.
whole nother, forms of anxiety, I'm sure, especially the first time you do it. Like, it's a
Mhm.
lot.
Yeah, yeah, yeah. And well, yeah, like you're saying, I mean, ultimately, it's that idea that your body, first of all, your nervous system, like became almost wired to be like, okay, I need to almost be on and ready at any moment in the night, right? So
Yes.
you're like, I
Can't
can almost
rest.
like prepare myself by becoming like tense beforehand so
Oh my
that
God, yes.
like I'm not shocked right on like impacts, that I'm kind of like ready for it,
That's
right?
so good.
That's a lot of what it, I think, is on an almost like nervous system level.
So you're
Uh,
just always you're just always like fight or flight. So I'm just like, I'm on the ready.
yes.
Like, I gotta just be on the ready, because if I
Yeah.
relax, then I gotta go from 0 to 100.
Yeah. Yeah. And
Mm.
it's that big piece, like you said, of really like, it's such a practice of being completely, or you can't be completely all the time because none of us are, but like
Yeah.
trying as much as you can to be in the moment of where you
Mm-hmm.
are, right? Which is, ooh, it's hard, especially if you're like,
So
yeah, you're
hard.
someone who is high achieving and
Mm-hmm.
likes to be productive and likes to have a plan and go into the day like, this is what we're gonna do, like,
Yep.
and
That's
it's,
me.
yeah, then I think it's so natural to then have that state of like, okay, now I'm in this place where I want to be able to anticipate when you're going to wake up from this nap. I want to know exactly how much time I'm going to have. And then I focus on that thing that I can't control, right? Then that
Mm-hmm.
makes me feel more anxious. So it's a lot of it is focusing within on what you can control, right?
Right.
Which a lot of it is bringing back to yourself, back to like you and your state of being in the moment, right? What
Mm-hmm.
thing you can do in that moment, knowing, right, and trusting also that if you don't get it done or that they do wake up, right, like it's that idea too that like nothing terrible is going to happen either way. But
Right.
it really is, I think, so much of it lives in your body, right? And I
Oh
think
yeah.
it's like the practices that are more like proactive rather than
Mm-hmm.
like only giving you things to do in the moment, because I think
Totally.
it's like teaching your body to come back to a place where it is safe in this new way of life, in this new environment.
Mm-hmm.
Because we've got so much, I think, external validation and like, reinforcement from doing things and being able at the end of the day to say, like, I did XYZ
Yeah.
and I can check it off. And it just like gives you that like relief, like I checked it off.
Mm-hmm.
And I think the women, a lot of us, right, who are high achieving and who want to check it off, it's like, like it's not, it's not done, right? Like there's that one part of it,
Yes.
or it's not going to be done.
Mm-hmm.
And to be really clear of like be really honest with yourself of like, what are the real priorities and real things I really, really actually need to get done today, right?
100%.
Because
This is
it's,
so
yeah.
good. Especially because, like, that is why last year, like, I feel like my business grew so much because I had to be so focused on the only things that matter.
Mhm.
I only have time to do the things that actually matter. And
Yeah.
literally nothing else can exist because there's just none of that time. So it, like, that's like such a positive of it. But what you
Hmm.
said of, like, for high achievers, which most of us are in this, like, day and age of people listening to this podcast, especially like prior to pregnancy, like, not to pregnancy, prior to giving birth, you, as high achievers, we probably checked off a million things a day, right? And then you go from that to, like, not a standstill. You're still also, you're keeping a human alive. Like, that's something to check off of a box, but it's not like that productivity, masculine energy.
External. Yeah. Hmm.
Yes, that like we're used to. Um, and even once you start getting back into it, after a few months, it's like it's still not. I don't know. It just feels different, and the
Hmm.
being is way harder. I feel like now than it was prior to having a child, because you just had endless amounts of time and space to do like whatever you really wanted to do. Like, obviously
Hmm.
aside from work and all of that stuff. So, and like you said before too, like we don't have the space to like untangle all of this all the time and like, reset our nervous system. Like we have a little time to do all of these things. So what are ways that you can help foster like being more and being more intentional? Something that like will help me is like, especially with like middle of the night stuff, to help me with that like anxiety and just like in the moment, especially if she's up for 2 hours in the middle of the night, which is like so difficult.
Mhm.
Just like 2 straight hours, like it's just like wild. But anyway,
Right.
like I'll remind myself like, okay, in 5 years, I'm just gonna like pretend that this is me like transporting back in time, like having like one more night with like my baby at this age, and like they're never
Mhm.
gonna be this age again. And
Mhm.
just like that helps me get in the present moment, because I could like cry thinking about it, of just like if I could go back to when she was like 4 weeks old, I'd like, oh my god, I would love to. And then in a couple years, I'm gonna want to do the same thing to the age she's at now. So it's like,
Mhm.
even though it's so fucking hard in the moment, in
Yeah.
the like nighttime stuff or whatever it is, it's like that will help bring me back to the present moment. But what are some things that you do or you recommend for like your mother clients to like be more? Because that is something
Mhm.
that's, one of the biggest like blessings you can give yourself as a mother, but also one of the hardest things in my opinion.
So hard. Yeah. No, yeah. And I think it's, oh, yeah, it's hard. And it's the idea of, I think that piece is helpful, right? Of like giving yourself perspective and like zooming out, like you're talking
Hmm.
about, right? But I think it's also, there is definitely an individuality to it where some people really need that full validation of like, you're allowed to say that this sucks and like that this is really hard in the moment, because I think it depends for everyone. Like if it feels like you're almost trying to do it in a way where you're like resisting your own resistance or your own frustration or your own
Yes.
overwhelm and like judging that you're doing that, right,
Mm.
that can like have you battling yourself.
Hmm.
So just being like, first, like, okay, this is here, this is how I feel, and but it's not right reflective of like me as a mom or my care for my baby or how much I love them or whatever it is,
Oh,
right?
like acknowledging that it sucks doesn't mean that you're not grateful for your baby.
Yes, like to
Yes.
be able to know like both of those are existing at the
You don't have to
same
feel
time
guilty.
and can exist at the same time.
Yes.
And then really, I think it's the idea of like to be more present is it's a muscle that you have to work, which is
Like
what I tell
meditation.
clients. Yeah, meditation is a muscle that we all have,
Mm-hmm.
right? But that we need to actually like strengthen, like you would strengthen any other muscle, right?
Right.
And you actually have what's called like a tone of your vagus nerve,
Mm.
that your vagus nerve can be more toned or less toned based on, right, and you can increase the tone of your vagus nerve, which is what regulates your ability to go into rest and
Mm. And
digest
how can we do
mode
that?
through deep breathing, through singing,
Oh,
through
like humming.
humming.
Okay, yeah.
So
I do
yeah,
that when I'm
so
rocking her. I'm like, hmm.
yeah,
Yeah,
yeah, the
I'm
humming,
like,
yeah,
oh.
yeah. So you can do those things in the moment, like
Yeah.
I feel like you've mentioned on other podcasts, like just like you can't be in a bad mood when you're singing, right? Of just
Yeah,
like
yeah. It's so true.
doing things, right? Of in the moment where maybe it is like acknowledging that this is what I need, and while I'm holding them, I'm going to put this in my headphones, right, and listen
Yes.
to whatever it is that I need to sing to or hum to. Um, but it also is a practice. So I would say, even if it feels like I have no space in my day to like
Mm-hmm.
stop and do a meditation, which I could probably challenge you on that. You probably have like a minute or 2 minutes.
100%.
But, or just even while you are doing something
While
with
you're
your
feeding
child.
them, while,
Yeah.
yes. Mm-hmm.
Like your children are your greatest teachers for being mindful, being present.
So real.
And so, like, even just being like, during this time that I'm with them, that's going to be like my mindful, like, couple of minutes. And I'm going to
Mhm.
just lock into, and not during a time that feels really frustrating and stressful for
Right,
you,
obviously, yeah.
a time that
You like
maybe
giving them a
generally,
bath.
yeah, when you're feeling like in the
Hmm.
bath or in whatever, playing with them, rolling around,
Yeah.
whatever you're doing, like, to just take that moment and really using similar, right, of like the five senses of really taking in the sights and sounds and all of what's happening in the moment, um, almost through their eyes, right, because that's how they're experiencing the world, right, all the time.
So
So
crazy. Hmm.
just taking like a moment to do that, it will start to build that muscle, and you'll start to notice that you do that more naturally, or it's easier for you to pull yourself back into the moment, because that's what your vagus nerve is about. It's about the stronger that is, the more toned it is, the more quickly you can shift out of fight or flight back into rest and digest, into that calm, nice state that we want to be in most of the
Right.
time.
So taking your breaths, humming, like doing that stuff in the moment, and also obviously like having separate meditative practices and stuff could help
Yeah,
tone
yeah,
that vagus
definitely.
nerve.
Yeah, the other thing I would say, along with like listening to things, if you need something more like soothing for yourself in the moment, is the bilateral stimulation piece of it through EMDR. There is bilateral stimulation music.
Oh,
So if you go on EMDR, not EMDR, on Spotify, and look up like bilateral stimulation music for
oh.
anxiety, for
Oh, I
sleep.
wonder if that's I listened to, oh, maybe that is. It's called so now maybe I'm thinking that it is. Binaural beats.
Binaural beats. That's
Yeah.
another, yes,
Is
same
that
thing.
it?
Yeah.
Oh, amazing. I listened to that that's so wow. And I do. I feel like, because sometimes I'll do a guided meditation, but mostly lately I just like, I don't want to hear anybody else's voice. I just want to like listen to this music
Silence.
and just like silence. Yeah. Um, and I've been listening to that. It's on Spotify. I don't know anyone who's listening. We'll put it in the show notes. It's called Binaural Beats
Mm-hmm.
Meditation, and they have a bunch of different tracks. They're so good. Okay, so that's part of that. Amazing. Good to know.
Yeah, that's
Um.
a helpful one. You need headphones, just so you know,
Oh yeah, yeah, yeah. Oh right,
because
so you could hear back and
it has
forth.
to be, yeah, in either ear. Yeah.
Right.
Mm-hmm.
Okay. Yes. Um. Okay, I love that. And then something that you kind of touched on that was another thing I wanted to bring up was like acknowledging the things that you don't love about, motherhood maybe allows space for the things that you do love. Because you said in one of your posts, like you can't just block unwanted feelings, you'll block everything type of thing. So can you talk about
Yep.
that?
Yeah. 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 I mean, the idea that, when we think, I guess, that we can say like, all right, I'm going to put all these emotions about this thing, right, and push it away or numb it, right, or
Mm-hmm.
separate from it. And if you do that a lot or in a long-term way, you wind up feeling a little numb in general, because we don't have the ability to decide which emotions we're going to disconnect from.
So you just
In
disconnect
that,
from everything.
right. So you kind of just start to like numb everything.
Wow, it's so
And
real.
we can do that in ways we don't even realize, of just kind of like dissociating or zoning out or disconnecting from our body, or like doing things. And it's all like protective,
I was
generally,
gonna say
like
it's like a survival
mechanism.
mechanism.
Yeah.
Mm-hmm.
It's a way to protect yourself. So
Mm-hmm.
it is something that I think it's, yeah, being aware of that and understanding that. I think in the bigger picture, it's really that idea of like, society doesn't, I mean, we're getting so much better at it, but
Yeah.
society still doesn't leave a lot of space for you to say like, I'm feeling this way about my birth, like I feel like it was, traumatic, or I felt like whatever it was, if you have a healthy baby. And I think especially for women who have gone through fertility issues, have gone through miscarriage, have gone through something
Yes.
traumatic, it's almost like, well, I went through this, and now I don't feel like, I should be grateful, right? Because
Yes.
I know what it's like to struggle to not be able to have a baby, or to lose a baby through miscarriage, or whatever it is.
Like they don't have the right to not like a certain part of it, or they feel guilty. Like,
Yes.
how
Or
can I
there's a
feel
guilt.
guilty
Yeah.
for, being pissed off at the situation when I wanted it so bad? Yeah. Or
Yep.
even like once they do get pregnant,
Yep.
like, when you're first pregnant, like your hormones are all over the place. There's so many different thoughts. Like some of my clients will be like, oh my God, like I'm just nervous now. And like, I don't know, da, da, da. And I'm like, it's normal. And it's like, okay, you were trying for so long and you're feeling like that. So, okay. So that's such a good
Mm-hmm.
example.
Yeah, exactly. So I think that that's like a huge one. And then if you go into postpartum, right, and then you're like, oh, I made a mistake, right? Or I, like, all of a sudden you're like, oh my God, this is like, which I think we still don't have we're getting, again, better and better of being clear of like, this is actually what postpartum looks like, and all the struggles, and like, but it's still,
It's
I mean, we
intense.
still do like baby showers that are all about like, here are all the things that you need and all the whatever. And it's like, how are you going to prepare to
Who's
take
talking to me
care
at
of
5
yourself?
p.m. every night when I'm sobbing?
Yeah. Yeah.
Literally.
Yeah. And I think it's just,
It's so
yeah,
crazy.
it's like, so I
That
don't think
first
that
week
there's
is wild.
enough of that. Yeah. Yeah.
Mm-hmm.
Oh, yeah. The first couple weeks are, It's a lot. And it's just not something that I think that there's enough space for. I do think also some of that, if you're in the process of maybe trying to get pregnant and fertility piece, it could be such an investment to do that type of trauma work now, because again, it will, I think, help resolve some earlier experiences that might connect to feelings of guilt, right? So that you don't carry that extra weight of those experiences into the postpartum period that is already so heavy with emotions and transitions and triggers, hormones, all the things. So it could be like, if I could go back, that's what I would try to do more of, right? Of just giving myself that like ability to, you know, really like address some of those things if I can, so that I could kind of release some of that and not bring that into my motherhood journey.
100%. It's like preparing your body physically. Like preparing your body to get pregnant is also going to help support you, you know, rebalancing postpartum with more ease. Like, thank God you know, postpartum is difficult in and of itself on its own, just the shock of everything. Like, I can't imagine how much more difficult it would have been if, like, you know, my hormones were all over the place. I didn't know like how to nourish myself, like all of that. So it's like both of those things. It's so important, especially mentally, because like you're going to want to be able to enjoy your baby. You're going to want to be able to not pass on these traumas to your future child. And like, we're all gonna, like, we're going to mess up our kids in some way. Like, it is what it is. You know, they're going to be in therapy too at some point, probably from something. It's just fine. But like, you know, doing things that you can ahead of time to support yourself, I think is so, so huge. But I love that. So back to that. So acknowledging things that you don't love, you know, allow space for things that you do love. So, you know, I guess it could be different for everybody. So I guess it could just be like acknowledging it in the moment, knowing it's okay. And then like doing a practice to then bring yourself back into the present. Like, okay, yeah, like we talked about in the middle of that. Okay, yeah, this sucks. And also, where can I find like the, you know, the like silver lining in this?
Yeah. Or even just being neutral, I think, and not forcing yourself, I think, is like just not judging that that's how you feel in the moment, allowing that emotion to come up fully. Right. And then also not saying like, oh, now I need to move into a place of like pure bliss and like force myself. I feel like a lot of like, when you like try to force things like gratitude, sometimes I think you wind up like gratitude shaming yourself. So I think just, okay, let me just be neutral, right? And that's where the mindfulness piece could be helpful, right? Of like, okay, I'm noticing this emotion, it comes up, I kind of let it dissolve a little bit, and then I can go into like using my five senses, or like looking at like just from that more neutral place of like observing your baby, just like looking at them, right? And then naturally
smelling them.
Smelling them, touch, right? Like, I mean, you have that whole sensory experience.
I'm like, oh, I love your smell. My husband's like, you're so weird. I'm like, I just love her smell. Like,
I know, like a little breath. I'm like, I love your breath.
I know. It's so weird. It's like, but it's like, they literally live inside of you. Like, it's just like so crazy.
Yeah. But no, I think it's not, there's so many aspects of it that are not pretty and that are hard and that are just raw, and moments where you want, you know, more space for yourself. You're wishing and grieving life as it was before. You're like all of those things that are just, you're scared to say them, right? Because you're like, oh no, then other people are going to hear this and then think I'm not grateful, or think that I'm not a good mom, or and then as soon as you, I mean, talk to any other mom and say any of them, I remember doing that myself and being like, oh my God, I have to text someone about this because it feels like this big secret, and then being like, yeah, of course I felt like that. And it's just like, oh, okay, like going, if you could physically see another mom, or at least talk to another mom who's gone through it. I joined a 4th trimester support circle at the nesting place, which those are
amazing,
wonderful. And that was just
so helpful,
life-changing, pivotal moment in my postpartum journey for sure. Just for you to be able to see another mom in the same space as you, or similar space, that you just are able to have so much more compassion for yourself. I think we're so hard on ourselves, but as soon as we can see ourselves in someone else, we can start to be like, oh, like I'm not judging you, I'm seeing you, and now I can kind of bring that compassion back to myself. So that's a huge piece of it that I think is about acknowledging the things that suck, but doing it in company with other moms, right? So that you're like, okay, I'm not alone. Other people experience these things. And now that I do that now, oh my gosh, there's all this space now where I used to be holding on to and judging and worrying about all these negative feelings, that now that I've released that, I have all this space to enjoy things as they are and enjoy the things that naturally I feel naturally grateful for and that just come up. So
and then like when you experience a negative emotion, you're just experiencing that. You're not experiencing that and the guilt for experiencing that.
exactly.
You know what I mean? So it's like, I remember for me, the first week postpartum was the hardest for me. I think having my like placenta encapsulations helped so much for it not continuing. But like that first week for me was like, I was just like so, if it was like 5 o'clock every night, I was just like sobbing for that first week. And it was like, it was like grieving, like the old routine I had around that time of night, you know, and I was just like, remember talking to my sister and my friends, like texting them about it, like, did this happen to you? Like, because they were further along, they already had kids. And it was so helpful just hearing like, yes, like this exact thing happened to me. It's so normal for you to feel like this. Like everything is literally different in an instant. Like just feeling that, I was like, okay, so then I would just experience it and not be freaking out of like, oh my God, like I'm a horrible mother because I feel like this, because I was like, I'm so obsessed with her. Like it was just a weird duality of like that feeling that you feel, and you could only experience it if you've experienced it. But I love that connecting with other mothers, even like in the same stage as you, for sure. And also ones who maybe gone through it, so they could tell you like, hey, like I got through it. It's okay. It's normal. Like it's normal. Just hearing like it's normal. It happened to me too. That was like literally all I needed to hear. I was like, okay, perfect.
Definitely. Yeah. I had a friend who used to drive by my house. She would drive by and do like drive-by hugs and come and like connect with me and stop at my house and hug me.
It's so amazing.
And she was like a mom who, you know, has older kids.
I
but just like, just that connection.
Register for that. For your baby shower. Drive-by hugs.
Drive-by hugs. Like we all need it.
So
but
good.
just that connective piece too. I mean, like you're connecting with the baby and you're getting all that, but just like someone to hold you, right? That idea of like hold the mother, right? And,
oh my God.
But I think it's so, the connection piece is just huge. And
obviously like motherhood, parenthood in general, it's like a huge shift and change for, you know, fathers as well. But it's different for the mom. I think it's just way, you know, because you not only are going through that change mentally and emotionally of like, wow, my whole life is different, but you went through so much physical change, and like you're the only, it's just amazing. It's just wild. But anyway, okay, this was so amazing. We could talk for hours, but I
know what time it is. Oh, okay.
It's time. I would love for you to let people know how they can connect with you. You take clients virtually, obviously.
Yep, virtually and in person. So my practice is based out of Long Beach, New York. So I have virtual appointments and then some in-person available too of clients.
EMDR is just in person, or is it also virtual?
You can do virtual also.
Okay, that's good to know. Yeah. Okay, amazing. So we'll put all that in the show notes, like your website. Your Instagram is Dr. Natalia.
It is at Dr. talking Dr. Tal.
Okay.
So it'll be in the show notes, but it's talking and then Dr. and then Tal. It's my
amazing.
Instagram. Yeah. And I also recently started my own podcast to talk about some mental health stuff related to motherhood. So I just started, there's like my second episode coming out next week. So
good timing. Okay. What's the name of it?
Yeah. It is called the Mom Mentality Podcast.
Ooh, so good. Okay. We'll put that in the show notes. The Mom Mentality Podcast. So good. I love this. This was such an interesting conversation. I think just like really good for people to hear of just, those questions to ask themselves that we talked about on the top, and like really getting into the present moment, regulating themselves, knowing what's normal. Like we're all in it together, especially everyone here who is a mom or on your way to be a mom, like all the things.
Yeah.
So thank you so much for the time. And I will put all your information in the show notes. And if this resonated with you, would love for you to share it on social media, tag me, tag Natalia. You could even just send us a DM. And yeah, I appreciate you being on the show.
Thank you so much.
You're welcome. Have a great day.
You too.
Thank you so much for being here. If you loved this episode and learned something valuable, please share it with a friend who you think would also love it, or post it on social media and tag me so I could personally say thank you for helping me spread this important message. I am beyond grateful to be here with you. So until next time, stay intentional, stay consistent, and always mind your hormones.